Now with a report on body image, here's our reporter Laura Windsor.
Roger, diet and exercise are important factors in a healthy, shapely body. But for some, it doesn't quite do the trick. In Fort Myers, Florida, we spoke with Dr. Robert Brueck about the advantages of liposuction.
It's a procedure that we use to go ahead and eliminate unwanted pockets or areas of fat. Many times in my practice, women will come in and say, you know, Dr. Brueck, I have the same genes as my mother and my aunt. I have these big saddlebags, these big hips. And no matter how much I exercise, no matter how much I diet, I can never get rid of it. That's the kind of person that would be a perfect candidate for liposuction. In essence, what tumescent liposuction is we're infiltrating fluid into the area where we want to remove the fat. We allow it to sit for 10-15 minutes, and then we go ahead and remove it very carefully. The nice advantage of liposuction is it's done through tiny incisions. So unlike years and years ago where we would have to make big incisions to cut large areas of fat out, now we can make a small incision, 3-4 millimeters, put a cannula in there, and remove the fat. And the results are excellent. Early on, the people that we would do liposuction on tended to be younger people, 25, 30, 35. But as the process has progressed, we now do older patients. But in terms of obesity, it is not a cure-all for obesity. It is not. I always tell people you should try to diet, you should try to exercise. And of course, when somebody's morbidly obese, like 100, 150 pounds overweight, then they become candidates for a gastric banding or a stapling procedure. But liposuction is designed primarily to remove unwanted areas of fat. It doesn't mean somebody has to be a perfect figure, but somebody might be hefty, if you will, but they have saddlebags. When they put on their slacks or their jeans or whatever, it's a little tight in the hips. And so that's a perfect candidate. They come in, we liposuction the fat, and they go home a happy person. One lady that I did, she was in her 30s, very healthy, and she ran every day, and she came and said, Dr. Brueck, no matter what I eat, no matter how many miles I run, I can never get rid of these saddlebags. And so I said, well, I have a method to do it. We'll do a little liposuction. So we set up a time, took her to the operating room. We removed maybe 50 cc's of fat, not a lot, but it was enough so that her hips didn't bulge out. They had a normal flow, a normal silhouette, and she was happy as can be.
What areas of the anatomy can benefit from liposuction?
The most common areas for liposuction on a woman would be the hip and saddlebag areas, the abdomen, and the flanks, the lower back. On a man, the two most common areas are chest and the saddlebag areas, the love handle areas. Those are the most common areas.
And what is the recovery time from this procedure?
Actually, the recovery from liposuction is not all that bad. I always tell people experiences in recovery from any operation will vary from patient to patient. I usually let my patients shower the very next day. They can get dressed. We usually put them in a compressive binder. They can walk around. I want them to walk. I want them to ambulate. And the incisions are tiny ones, like we mentioned before. And we take the stitches out 4, 5, 6 days. Real physical activity, running, jogging, probably 3 weeks. But for most people, you can have a long weekend, have the liposuction procedure done, and then go back to work.
Liposuction performed by a qualified specialist is safe and effective and can definitely enhance a person's self-image. For the American Health Journal, I'm Laura Windsor.